Good evening, everyone. Thanks for coming out tonight. I'm Mary Cornelius, an obstetrician gynecologist right down the street here on 15 Mile Road. And I'm here tonight to share with you all some information to help you talk to your kids about sex. And I hope that you leave tonight understanding a little bit more about why we need to talk to them, when we need to talk to them, and a little bit about how to approach talking to them. Let me say up front that I am not the parent of an adolescent or a pre-adolescent. I am not a pediatrician or a psychologist or a licensed educator. I am, however, a physician, and I am a mom, and I have been taking care of adolescent and pre-adolescent girls for 11 years. And I've seen a lot, and I want you to keep in mind, keep that in mind as I talk to you tonight, because I'm going to present you with the facts and the evidence-based side of why you should talk to your kids. But it's really up to each of you to bring your values to that talk. And that's a unique aspect of that talk that I'm not going to talk about tonight. And I know that me standing up here and talking to you and saying, it's easy for me to say words like penis and vagina and oral sex, because that's what I do. Those words are easy for me to say, but that's not going to make your job any easier when you go home and have these difficult conversations with your kid. It's not going to make it any easier to look in the eyes of your 11-year-old daughter and have these tough talks. And that's one of the things that we just have to do as a parent. But what I do hope to do tonight is arm you with some information, and information is power, and affirm and confirm to all of you that research has shown over and over again that kids who feel they can talk openly to their parents about sex and drugs and alcohol are less likely to engage in those behaviors. They are more likely to wait to have intercourse, and they are more likely to use contraception when they do. So the lines of communication are really important. So if it is so awkward and uncomfortable for us and for them, why is it so important that we talk to them? Sex is an important part of being human. It is far more than the physical act of intercourse. It affects how we feel about ourselves as males and as females. We want our kids to develop healthy attitudes about sex. We want them to learn responsible sexual behavior. We want to provide kids with accurate information about sex. The information they're getting elsewhere may not be true, and it may not reflect the moral and personal values that you want your kids to follow. And finally, of course, the kids need to know the consequences of being sexually active. So the best time to start these conversations might actually be earlier than any of you wished, but the best time to start is actually the ages 9, 10, 11 years old, okay? Sex education starts in the public schools in 5th grade. That's about that age. It's important to start early, be open, and listen. And I think it's important before you sit down and talk to them, is to examine your own views about sex. Think about how you feel about sex and how you want your kids to feel about sex. And if that starts to make you really feel uncomfortable, admit it. When you sit down and talk to your kids and you're uncomfortable, tell them, I'm really uncomfortable having this conversation with you because my parents never did. But I want us to talk about anything, be able to talk about anything, including sex. So please, if you have any questions, come to me. And if I don't know the answer, I'll find out. I think just saying that you're uncomfortable and being honest with your kid negates and breaks down some of that awkwardness itself, and the child sees you being honest, and they're more likely to be honest with you. So it's more, I guess, it's more important how you respond to your child than what you know. So, remember that. And also remember that it's your opportunity to communicate your own personal values, and the days of kind of like having the talk about the birds and the bees, this one-time talk when they're 10 years old and then never bringing up sex again as long as they're in high school are over. I mean, it just isn't like that anymore. We just don't have this one talk like, okay, this is how people have sex, and this is how we make babies, and then never talk about it again. You have to keep the conversation going. And as your kids get older, different questions will come up. You have to make it clear that you're willing to talk about sex and sexuality. And as they, when they're a middle adolescent, I mean a 15, 16, 17-year-old is going to have a lot different questions and feelings than your 10, 11, and 12-year-old who's just learning the anatomy and the facts. So the next two slides are essentially the list of the things that would be included in a comprehensive talk about sex, okay? And I think you start with the basics. You're talking to your 10, 11, 12-year-old, you start with the absolute basics, you take the mystery away from the sex thing. You get out the anatomy textbook, you get it from the library, you download it however you want to get it, you look at the female human body and you look at the male human body, and you point to the parts and you name them. And you say vagina, and you say penis, and you say testicles, and you say ovaries, and you say uterus, and you tell them what they do. And you use, like I said, you use the anatomically correct words, and you don't be afraid, and you explain to them this is just part of being human. This is, these are our human bodies, this is how they're different, and this is how they work. And then once you get through the basic anatomy, you go on and you talk about the physical act of intercourse. And you say erection and ejaculation, and you say sperm, and explain the physical act. And at this, in the next phrase you say, and yes, this is, this is how women get pregnant. This is human reproduction. This is how it happens. And there are ways you can have sex and not get pregnant. And that gives you your chance to talk about birth control. And you can bring up condoms as a specific example if you want. I think it's also important that when we talk about, vaginal penile intercourse, and this is how we make babies, and these kinds of things, that it's important to also bring up that there's other forms of sexual behavior. There's masturbation, there's touching, there's oral sex, that there are more than one ways that humans express sexual feelings. And I think it's important that these pre-adolescent and adolescent teenagers understand that there is more than this one act. Like I said, there's more than this one act of intercourse. It's also appropriate at that time to bring in the emotional aspects of sex. That sex is emotional and ideally shared between two mature people who love each other or who are married. And this is where you can bring in your own personal values when you talk about the emotional aspects of sex.